Hello everyone, I'm Dr.MemetIşık, a dedicated cancer researcher, passionate about exploring innovative therapies and natural remedies to support cancer prevention and recovery. In today's video, we'll uncover bladder cancer, its causes and risk factors, symptoms, screening, diagnosis, prognosis and survival rates. The bladder is a crucial part of our urinary system, a complex network that keeps our bodies clean and functioning. Think of your bladder as a temporary storage unit for urine. Urine, a mix of water and waste products filtered from your blood by the kidneys, travels down two tubes called ureters to be stored in the bladder. When you urinate, the muscles in your bladder wall contract, squeezing out the urine. It exits your body through another tube called the urethra. This whole process, from filtration to excretion, is essential for maintaining a healthy fluid balance in your body. Now let's talk about bladder cancer. This disease occurs when cells in the bladder start growing uncontrollably. Over time, these abnormal cells can form a tumor, a mass of tissue inside the bladder. Bladder cancer is a serious condition, but it's important to remember that it's often treatable, especially when detected early. Understanding the different types, symptoms, and risk factors is crucial for early detection and effective treatment. There are different types of bladder cancer, each with unique characteristics and potential treatments. The most common type is urothelial carcinoma, which starts in the urothelial cells lining the inside of the bladder. Another type is squamous cell carcinoma, which develops from squamous cells, thin, flat cells that can form in the bladder lining due to chronic irritation. Adenocarcinoma, a less common type, originates in glandular cells responsible for producing and releasing substances. Bladder cancer often doesn't show symptoms in its early stages. However, as the disease progresses, you might experience noticeable changes. One of the most common signs is blood in the urine, which may appear pink, red, or brown. Frequent urination, even when your bladder isn't full, can be another indicator. You might also feel a burning sensation when you urinate or have an increased urge to go, but pass only small amounts. Pain in your lower back or pelvis, especially if persistent, should also prompt medical attention. Risk factors. Who is at risk? While the exact cause of bladder cancer is not always clear, certain factors can increase your risk. Smoking is a major risk factor, as tobacco smoke contains harmful chemicals that can damage the lining of the bladder. Exposure to certain chemicals used in industrial settings, such as dyes, paints, and rubber, has also been linked to an increased risk. Age plays a role, with most cases diagnosed in people over 55. Your family history and ethnicity can also influence your chances of developing bladder cancer. Screening and early detection. Early detection is key in the fight against bladder cancer. While there's no routine screening test for the general population, individuals at higher risk, such as those with a family history or occupational exposure, might benefit from regular screenings. These screenings may involve urine tests to check for blood or cancer cells. Imaging tests such as a CT scan or ultrasound can help visualize the bladder and look for any abnormalities. Your doctor will recommend the most appropriate screening strategy based on your individual risk factors and medical history. Diagnosing bladder cancer. If bladder cancer is suspected, your doctor will perform a thorough evaluation to confirm the diagnosis. This process typically begins with a review of your medical history and a physical exam. A urine test to check for blood or cancer cells is usually the next step. Cystoscopy, a procedure that allows the doctor to directly visualize the inside of the bladder using a thin, lighted tube, is often performed. During a cystoscopy, a biopsy, the removal of a small tissue sample for microscopic examination, may be done to confirm the presence of cancer cells. Prognosis and survival. The prognosis for bladder cancer varies depending on several factors, including the stage of the cancer, its grade, and the patient's overall health. Stage refers to the extent of the cancer's spread, while grade describes how abnormal the cancer cells look under a microscope. Early-stage bladder cancer, when the tumor is confined to the inner layers of the bladder wall, has a higher survival rate. Treatment options for bladder cancer include surgery, chemotherapy, radiation therapy, or a combination of these approaches. Thank you for watching. If you found this video insightful, don't forget to give it a thumbs up. It helps support our channel. Hit the subscribe button and turn on the notification bell so you never miss an update on our latest educational content. And please share this video with your friends and family to help spread awareness and knowledge. Together, we can make a difference.